convince the patient for a simple procedure like root canal. So how do you feel passing on the legacy of Ashar Dental Care from you to me? So today I have a very special guest with me, one of the veterans, I should say, in the field of dentistry, and having a vast experience of almost uh, 45, 47 years now. He's retired now, but still the experience still counts. An amazing practitioner. A lot of his skills have, I should say, a lot of my skills I've got from him, none other than my dad, Dr. Sudhir Ashar, a veteran passed out from alumni of Nair Hospital Dental College, and an amazing clinician. Hi, Dad, welcome.
Welcome.
So, we'll be talking about his experience of dentistry. He keeps coming to the clinic for some dental issues or the other. And I just want to know today, where do you see dentistry today, what we practice at Ashar Dental to what you started in your career?
I see dentistry when my practice now you are practicing is a vast difference. You have a better technology than what we had. We had to do all our work manually. Like even chair, I have to come up manually, push pedal, and it will go up and go down. And even the treatment which I was giving was bit very inconvenient, not to me also but to patient. Inconvenient in the sense that for a one root canal you have to take very long time, whereas now root canal do in hours. That time we used to take 3 to 4 days to finish one root canal. So that is the difference of technology, and that is the main difference.
So, did you ever imagine, when you made crowns and bridges, that for last so many years, you've been also working with Illusion, we also worked with Illusion for last so many years, that there will be a day where you will scan a patient's mouth and you can actually see your, prep, send it digitally to the lab, and you'll get the crown within 24 hours?
No, I have not.
How many days would it typically take, to fabricate a crown in those days?
Those days it would take about 3 to 4 days.
Minimum 3 to 4 days. Did you ever imagine that you will get crowns which were absolutely lifelike, tooth colored? I'm sure those days you made
it was
some
difficult.
gold crowns and steel
Gold
crowns, metal crowns.
In my practice initially for 5 to 6 years, we used to do only metal crowns like gold. We call it Japan gold, and we had nickel chromium crowns.
Yes.
Then as time passed by, another 10 years, about 15 years after, we started doing ceramic crowns, and that too also it was very new for us.
So technology was one aspect. What about the patient, knowledge or the patient awareness?
Patient awareness was very bad that time, and we didn't have any equipment to convince the patient to do all the treatment, and to to give him some what you call confidence and what I will give him as a doctor. Now we can convince the patient very easily, and patient, after seeing all the latest development in dentistry, patient becomes so confident, and the treatment is done very
How
easily,
difficult it
fast.
was to convince the patient for a simple procedure like root canal?
It was very difficult in my time. The way of treatment was the tooth is paining. You apply some uh, uh, solution and let the pain go, and then you don't do any other treatment. That was the no. When I asked for a patient to X-ray, the patient will never come back.
Okay.
This is
So,
what I had faced in very early stage. Then later on,
as time evolved,
time
yes.
was patient started understanding. In
Got
my
it.
initial practice of 5 7 years, it took very long time to explain the patient that only this applying a cotton they've been a solution is not a treatment. You require a proper root canal treatment, proper restoration.
So, you just underwent a procedure of conscious sedation. Was it there at that time or
Never, no,
never?
no.
How different it is,
Very,
you.
very much different. Patient is so comfortable. I was so comfortable uh, with the treatment. I didn't have any pain or even no sensitivity after fitting the crown, and it was
It's
very comfortable.
fantastic. So how do you feel passing on the legacy of Ashar Dental Care from you
I
to me?
I feel very proud. Feel very proud, and I feel that my you as my son, you have fulfilled my all thinking that I will develop my clinic in that way that I'll have all latest equipment. You have fulfilled that. My
Thank you for the kind words, Dad,
uh,
and it's all because of your blessings that we have reached this level, and we continue to grow like this. Thanks for all the blessings.
thank you,
Thank you.
thank you.